Hello, great nurses. Welcome to the Career Pathway channel where we guide nurses on their pathway to success. In Module 4, we discuss the nature of radioactivity in relation to X-ray, radiological procedure, and radiotherapy. Here in Module 5, we will understand the principles of optics and light waves in application to healthcare. As we know, circles to success. Red circles indicate that these areas are a must know for your next exam. Orange circles indicate that these areas are good for clinicals, and green circles advise you to skim through this video later. Specific objectives for Module 5 are as follows. Define the following: optics and waves. List the types of waves. Explain the basic principles of the propagation of sound waves. Define light energy. Discuss properties of light. List the sources of light energy. Explain the following: propagation of light, reflection of light, transmission of light, and lastly, dispersion of light. 8. Discuss lenses. 9. Explain reflection of light through lenses. 10. Explain light application on simple lenses, human eye, microscope, common eye defect, and corrective mechanisms. So let's dive in. Objective 1. Define optics and waves. When you place a pulse oximeter on a patient's finger, you are harnessing light waves. That's physics. If you don't know how it works, you might misread a low SpO2 in a patient with dark skin due to light absorption differences, leading to delayed care. So SpO2 in dark patients may differ if you don't understand mechanism of light in physics. Definition of optics and waves. What is optics? It's a branch of physics that studies the behavior, properties, and interaction of light, including its production, transmission, reflection, refraction, and detection. What is waves? Waves, on the other hand, is a disturbance or vibration that transfers energy from a medium, solid, liquid, or gas, or space, without permanent displacement of the particles. Waves can be mechanical, which means it requires a medium. Example, sound is a mechanical wave. Or electromagnetic. Waves can also be electromagnetic, which means it does not require a medium. Example is light waves. So light waves are electromagnetic waves because they do not require any medium for transmission. There are various terms we'll be looking at. We'll look at their physics definition and how they are relevant to us as nurses. 1. Optics. We have said that it is a branch of physics that studies light's behavior, including its generation, propagation, and detection, and its interaction with matter. How does it relate to nursing? Optics powers every diagnostic tool we use, ranging from pulse oximeter, which deals with light absorption, ophthalmoscopes, which deals with retinal imaging, and IV infusion monitors, which deal with light sensors. Waves. Waves are energy carriers that transfer energy without moving matter. Example is light or sound. It's characterized by wavelength, frequency, and amplitude. Waves are your silent partners. Light waves check oxygen saturation, sound waves check ultrasound, detect bladder fullness, and any misunderstanding of these factors may lead to risk in misdiagnosis. Types of waves. The first one we'll talk about is mechanical waves. Mechanical waves are waves that require a medium. Example is sound, water waves. Types of mechanical waves are transverse waves. In transverse waves, particles vibrate perpendicularly to the wave direction. Example, light, water, and surface waves. Longitudinal wave is a type of mechanical waves. In longitudinal waves, particles vibrate parallel to wave direction. Example is sound. Secondly, we have electromagnetic waves. They do not require a medium. They travel through vacuum. Example is your light waves, X-rays, and radio waves. Take note of this thing. Electromagnetic waves, example light, penetrate tissues differently than sound waves. Pulse oximeter use electromagnetic waves. They fail in hypovolemic shock because low blood volume decrease light absorption. Ultrasound uses sound waves. It fails with Howell gas. It blocks sound transmission. So please check whenever you are having issues with your pulse oximeter. Okay, so let's continue. Waves and nursing relevance. We'll discuss the term, the definition, and their nursing relevance. Electromagnetic waves, for instance, is waves that do not need material medium. They travel through medium. How does it relate to nursing? Pulse oximeters uses red light or infrared light, ultraviolet sterilization, MRI, and radio waves. So these are how all these pulse oximeter, ultraviolet sterilization, and MRI, they all use electromagnetic waves. Mechanical waves. Mechanical waves require a medium. Example: solid, liquid, or gas. Examples of mechanical waves are sound waves and ultra waves. Nursing relevant. So Doppler ultrasound uses blood flow detection. Stethoscope auscultation uses sound waves in air. Number 3, transverse waves. So transverse waves. What is the definition of transverse wave? In transverse waves, particles vibrate perpendicularly to wave direction. Example: light is an example of the transverse waves. How does it apply to nursing? In nursing, the procedure of endoscopy uses light waves traveling through fiber optics. Longitudinal waves. Particles vibrate parallel to wave direction in longitudinal waves. Example is sound. How does it relate to nursing? Ultrasound imaging. In ultrasound imaging, sound waves will bounce off organs. That is how devices in the hospital use longitudinal waves. Objective number 3, to explain basic principles of sound waves propagation. In bladder scanning, air pockets absorb sound waves, leading to false empty bladder reading. Always hydrate patient first and use adequate gel. So whenever you are doing a bladder scanning for a patient, always ensure that the patient is hydrated and also use adequate gel for your procedure. We explain the basic principles in propagation of sound waves. 1. Sound is a mechanical longitudinal wave. It requires a medium, air, liquid, or solid, to travel. It travels faster in solids, slower in gases. Applications in nursing. Ultrasound scanning. In diagnostic imaging, we also apply sound waves in the use of stethoscope. Transmission of sound waves from heart or lungs. 3. We also use sound waves in the monitoring of fetal heart rate, Doppler effects, to check FH, that's the fetal heart rate. Principles explained further. The principle, the physics application, and nursing application. Reflection. In reflection, waves bounce off boundaries. Example: tissue interfaces. Nursing application. Ultrasound imaging. Sound reflects off organs, which creates image. Nursing action. Apply gel to eliminate air gaps. Air reflects 99% of sound. You see the reason why gel is applied. The next principle is refraction. In refraction principle of waves, waves bend when entering a new medium, which means that the speed will change. How is refraction applied to nursing? Doppler flow detection. Blood flow speed alters sound wave frequency. That's Doppler effect. Nursing action. Angle probe correctly to avoid false low flow reading. The next principle is absorption. In physics, it is energy lost as waves travel through tissues, leading to increase in heat. How does it apply to nursing? It is applied in therapeutic ultrasound. Therapeutic ultrasound is used to hit deep tissues for pain relief. Nursing action. Monitor skin for burns. Never use over tumors or pregnancy. We are not supposed to use therapeutic ultrasound on pregnancies. Objective number 4, to define light. What is light energy in physics? Light is a form of electromagnetic radiation visible to the human eyes. The wavelength range around 380 to 750 nanometer. It carries energy and travels in a straight line in a homologous medium. It is the energy carried by photons, particles of light in the electromagnetic spectrum. It is measured in joules. In nursing context, light energy isn't just brightness, it's quantifiable energy. A pulse oximeter emits 260 nanometer red light and 940 nanometer infrared light. Low SpO2 is equal to more infrared absorbed by the oxygenated blood. Dark skin absorbs more light. Modern devices adjust for this to avoid false lows. So this is the working principle of your SpO2 pulse oximeter machine. Objective 5. Want to discuss the properties of light. If a pulse oximeter reads 85% but the patient is pink and alert, check for motion artifacts. Light scattered from shivering or nail polish absorb light. Don't panic. So we check if the patient nails are polished. We also check if the patient is stable to avoid light scattering from shivering. Properties of light. One of the properties of light is reflection. Reflection means bouncing of light on a surface. The second one is refraction. Refraction means bending of light when it passes between two media of different densities. Third one is dispersion. Dispersion is the splitting of white light into component colors such as your red, orange, yellow, green, blue, indigo, violet, which is Roy-Wave. Number 4, diffraction. Diffraction is the bending of light around obstacles. The fifth property of light is interference. Interference is the interaction of two or more light waves. We want to discuss intricately the properties of light. So in discussing intricately the properties of light, number 1, light travels in straight line. Why do we care? It enables precise targeting. For example, using in laser surgeries. What is the clinical consequence? Misaligned IV laser guidance will lead to tissue damage. Number 2, second property of light, it reflects off surfaces. Why does it not care? It's the basis of ophthalmoscopes and otoscopes. Clinical consequences: if the lens is dirty, to lead to poor visualization, leading to missed retinal hemorrhage. Another property of light is that it refracts, as in it bends in a media. Why do we care with that? It is critical for lens function, for function of glasses and function of microscope. Clinical consequences: corneal edema, example in glaucoma, will lead to distorted vision, leading to false risk. Absorbed by pigments. This is another characteristic of light wave. It is absorbed by pigments. Application: why do we care? Pulse oximeter and phototherapy. Clinical relevance: jaundice in newborn. We use blue light, which is 460 nanometer. It is absorbed by bilirubin, leading to the breakdown of bilirubin in newborn that are jaundiced. Another property of light is that it's scattered in a turbid medium. How does this apply to nurse? It affects pulse oximeter reading in smoke or in edema. Hypovolemic shock, low volume leading to increase in light scatter, leading to false SpO2 drop. Objective number 6, sources of light. The X-ray you get for a broken arm uses less radiation than a cross-country flight, but repeated exposure adds up. That's why we protect you with the aprons. What are the sources of light? Natural sources of light such as sunlight, stars, and fireflies. Artificial sources of light include electric bulbs, lasers, X-ray tubes, and LED lamps. Sources: we look at the sources, we look at their nursing application and their safety notes. Sources, nursing application and safety notes. Number 1, incandescent is a source of light. Older exam light, warm continuous spectrum. Safety note: There is burn risk. Safety note, there is burn risk, right? 90% on the energy is lost by heat, so we must keep away from drapes. LED is a source of light. How does it apply to nursing? Modern pulse oximeters uses LED, surgical light uses LED, and otoscope uses LED. Safety note for us to take home: cool operation, energy efficient, critical. It is critical to verify the wavelength. For example, 460 nanometer is used for jaundiced therapy in newborn. Source of light continuation. Laser is a source of light. Nursing application: surgical cutting, retinal repair, IV catheter guidance. Safety notes: it may lead to eye damage risk, so never point at patient's eyes. Use protective goggles. Fluorescence is a source of light. How does it apply to nursing? Hospital room and lighting. There are fluorescent lights in the hospital and they are fluorescent. Nursing application: hospital room lighting. The hospital room uses fluorescent light. Safety note: flicker can trigger migraines in neuro patients, so switch to LED when using for neuro patients. Bioluminescence. Nursing application: lab tests. Example: ATP, swabs for sanitation checks. Safety note: there is need for infection control. If bioluminescence glow, it means that there is bacteria present in it. Objective number 6: explaining propagation, transmission, reflection, and dispersion. These are the factors we need to explain next in objective 6. Propagation, transmission, reflection, and dispersion. What is propagation of light? In propagation of light, light travels in a straight line. This is called rectilinear propagation. Transmission of light. Passage of light through a medium is transmission of light. Transparent, translucent, or opaque. So light is either transparent, translucent, or opaque. Reflection of light. The bouncing back of light from a smooth surface following the law of reflection. Dispersion of light. Separation of white light into a spectrum of colors when passing through a prism. Propagation, transmission, reflection continued. Propagation is a phenomenon. In physics principle, light travels in a straight line at 3 × 10⁸ meters per second in vacuum. How does it apply to nursing? It is applied in pulse oximeter. Light must traverse capillary bed. Action: ensure finger is warm. Vasoconstriction blocks light path. Next phenomenon is transmission. In transmission, light passes through transparent or translucent material. Nursing application: in IV tube monitoring, air bubbles scatter light, which leads to alarm triggers. If IV tube uses alarm trigger and there is air bubble in the bag, it will lead to alarm trigger, because air is not supposed to enter into the bloodstream because it could lead to air embolism. Action: prime lines thoroughly to avoid false air alarms. Phenomena. Reflection is a phenomena in light. Physics principle: light bounces off surfaces. Angle in equal to angle out. In ophthalmoscopy, it is applied in ophthalmoscopy. In ophthalmoscopy, cornea reflects light, leading to blocked view. Action: dim room lights. Align your eye with the scope's light path. So that's what the nurse must do. Dispersion: white light splits into colors, wavelength dependent refraction. Nursing application: it is applied in lab spectrophotometer. This measures hemoglobin via light absorption. Our action: nurses must calibrate devices to avoid misdiagnosing anemia. Why jaundiced lights are blue, not white? Jaundiced lights are blue, not white, because dispersion shows blue light, shorter wavelength has higher energy. This leads to the breakdown of bilirubin faster. Objective number 7, to discuss lenses. Using a convex lens to read a syringe magnifies the volume. You might draw 2 times the dose. Always use lenses parallel to the barrel. For those using glasses, very important note. Lenses or lens. Lens definition. Lenses are transparent optical devices that bend, refract light to converge or diverge it. Types of lens. We have convex lens. Convex lens is also called converging lens, while concave lens is called diverging lens. What are converging lens? They are thicker in the middle and they converge light rays. What are diverging rays? Diverging lens. Diverging lens are thinner in the middle and diverges light ray. So we'll be looking at the lens type, how it works, and nursing tool. Convex or converging lens. They are thicker in the center, which means they will bend light inwardly to a focal point. Nursing tool. Magnifying glasses, reading syringe labels, ophthalmoscope lenses. Lens type, concave lens or diverging lens. How does it work? It is thinner at the center, making it to spread light rays outwards. Nursing tool. It is a corrective lens for myopia, nearsightedness. The next type of lens is compound lenses. How do they work? They work with multiple lenses combining. Example, convex lens plus concave lens is a compound lens. How does it apply? It is used in microscope, ophthalmoscope, and surgical loops. Objective number 7, to explain reflection of light through lenses. Lenses refract light according to their curvature. Convex lenses focus parallel rays at a point called the principal focus. Concave lens spread out rays as if they originated from a focal point. Key physics. Lenses use refraction, not reflection. Lenses use refraction to bend light. Reflection occurs at lens surfaces, leading to glare. Nursing impact. Anti-reflective coatings on ophthalmoscope lenses reduce glaring, leading to clearer view of the retina. If uncoated, tilt the scope slightly to avoid corneal reflection. In microscopes, dirty lenses reflect light, leading to missed pathogens in urine samples. Next objective, to explain the applications of light in healthcare. Light application. Light is applied in simple lenses. It is used in magnifying glasses to enlarge images for better view. Physics. Magnification equal to focal length ratio. So basically in physics, magnification equals to focal length ratio, and the formula is m equals to v over u, image height over object height, or image distance over object distance. Nursing application. Magnifying lenses for wound inspection. Hold at 25 cm. This is standard focal length. Standard focal length is 25 centimeters. Closer, if you hold the lens closer, it will lead to distorted view, leading to misjudged infection depth. Never use for syringe reading. It will lead to parallax error, which will cause dosing errors. The human eye. The human eye lens focus light on the retina. Defects include short-sightedness, which is myopia, or long-sightedness, which is hyperopia. In physics, cornea plus lens is equal to convex system focusing light on the retina. Dry eyes will increase light scattering, leading to blurred vision. Artificial tears restore smooth corneal surface. Glaucoma will lead to increase in intraocular pressure. leading to optic nerve damage, which will result in vision loss. So it is very important to monitor intraocular pressure with tonometry or tonometer. Light reflection method. Tonometer uses light reflection method to detect IOP. Microscope is another way we can apply light. Microscope uses a system of convex lenses to magnify minute objects for medical analysis. Example, blood smear bacteria. In physics, compound lenses magnify 40 times to 100 times. So your microscope can expand 40x to 1000x. Light illuminates specimen. In urinalysis, adjust the light intensity. When the light is too bright, it will wash out cast or crystal. Clean the lens daily. Oil smudges will cause false negatives. Never force focus knobs because it will break the slide, leading to biohazard. Common eye defects. Common eye defects number 1 is myopia. Near objects are seen clearly in myopia, distant objects are blurred. Corrected with concave lens. So myopia is corrected with concave lens. Take note, hypermetropia, which is long-sightedness. What does it do? In hypermetropia, distant objects are seen clearly, near objects are seen as blurred. It is corrected with convex lenses. Number 3 eye defect is astigmatism. Astigmatism means blurred vision due to irregular curvature of cornea or lens. It is corrected using cylindrical lens. 4th eye defect is presbyopia. Presbyopia is age-related difficulty in near vision. It is corrected with bifocal lenses. Let's look at the corrective mechanism. Corrective mechanism for eye defect include glasses or contacts. Glasses compensate for refractive errors. Concave for myopia, convex for hypermetropia. Laser surgery or LASIK reshapes cornea using ultraviolet laser to correct focus. What's the nursing role in this corrective mechanism? After a cataract surgery, block blue light, e.g. sunglasses. New IOLs lack natural lens. Ultraviolet protection. Monitor for endophthalmosis because of redness plus pain will lead to emergency. Light reflection changes in cornea. Common eye defects. As a form of summary, we'll be looking at eye defects, physical causes, and nursing intervention. Myopia, which is nearsightedness. Eyeball is too long, leading to light focusing in front of the retina. Nursing intervention. Provide concave lenses. Warn about fall risk from blurred distance vision. Next defect is hyperopia. Hyperopia is far-sightedness. The eyeball is too short, leading to light focusing behind the retina. Nursing intervention. Provide convex lenses. Check for headache from eye strain. Presbyopia is the next eye defect. It results from aging. Lens loses flexibility, which makes it not to be able to focus on near objects. Nursing intervention. Teach patient to hold reading material farther away. Recommend plus 2.0D readers. Cataract. In cataract, cloudy lens scatters light, leading to blur vision. Nursing intervention. Before operation, assess visual acuity. After operation, prevent rubbing. This will increase intraocular pressure. Application of lenses to nursing. Number 1, microscopes for viewing microorganisms, blood cells, and tissues. Ophthalmoscopes to examine the retina and internal eye structures. Fiber optic endoscopy for minimally invasive surgeries. Number 4, laser surgery. For eye surgery, e.g. cataract, refractive surgery. Number 5, illumination in operating theaters ensures proper visualization. X-ray viewing requires understanding of light transmission and reflection. All these are application of lenses in nursing. Take note of this, it's a possible exam question. Answer this question in the comment section. Number 1, why do jaundiced lights use blue light? Number 2, what causes false low SpO2 in a patient with dark skin? I want you to answer these questions in the comment section. Let me know if you follow the class. As I round off, it's important to discuss the circles to success. For the circles to success, in red circles tells us to take note of the applications of light and lenses, including calculations that will be done in class. There are some calculations that will be done in class. Please take note of those calculations. For example, is the lens formula, right? I over F equals to I over V plus I over U. Green circle says we should go through this video again. Orange circle, please take note of every area that are indicated with orange circles, as you may need them for your clinicals. I want to thank you for staying this long for this video. In case you have not subscribed to our channel, kindly subscribe to this channel. It makes me know how you follow the class. I want to thank you for staying this long. Till we meet in Module 6. Take care.